go over the main parts of a kidney. So I've got a jumbo size one here for you guys, which will make it so much easier for us to see all the detail. And the first thing that we should mention is the outside of the kidney is covered in what is called a fibrous or renal capsule. Fibrous or renal capsule. We can also see this gland here. This is the adrenal gland, sometimes called suprarenal gland, but the adrenal gland. And if we turn the kidney around, the first thing we want to do is break it up into its two major components. So this outer area, kind of like the rind on the kidney that's going around here, this is known as the cortex of the kidney, the renal cortex. The middle of the kidney and all the equipment inside of that is known as the renal medulla. So general terms, renal cortex going around, and then the renal medulla in the middle. Coming out of this middle area, the medulla, we have what's known as the renal pelvis. The renal pelvis is the enlarged or swollen part of the ureter. Remember, the ureters are the tubes that are going to drain urine down to the bladder. So you've of course got a ureter on either side and a kidney on either side. So renal pelvis, the enlarged area of the ureter, and then we have the ureter, which will drain the urine downwards towards the bladder. We can also see here this renal artery and renal vein. So the renal artery, renal vein, and the renal pelvis, where all these guys come together and enter the kidney in this indentation, is known as the hilum, the renal hilum, where the ureter, the renal artery and the renal vein all enter the kidney in this indentation known as the renal hilum. So in addition, we have, with the cortex and then the medulla, inside the medulla are these triangular shaped features known as the renal pyramids. Renal pyramids, and that name makes a ton of sense because they do look like pyramids. So renal pyramids. And you can have somewhere between 6 and 18 of these, depending on the person. The tips of the renal pyramid, so where the tip of the pyramid is, that's known as the renal papilla. Renal papilla, so the pointy end of the pyramid, renal papilla. And in between the renal pyramids, we have these walls of tissue separating the pyramids, and those are known as the renal columns. Renal columns, and that's separating the renal pyramids. Then each renal pyramid attaches to one of these smaller tubes. So you can see these small tubes here. There's two small tubes here as well. And then we can see some openings to some tubes. Those tubes are known as the minor calyces. It's minor calyx if we're talking about just one, but altogether it's the minor calyces. And the minor calyces will join together to form a larger tube. There's one here, there's one right there. So see the two tubes join together to form a larger tube? That is known as the major calyx. Minor, minor, major. And these openings are connections to, or openings to, the minor calyces that again will join together to form larger tubes like this one and like this one, which are known as the major calyces. Major calyces. Okay? So we've got the medulla, we've got the cortex, we talked about the pyramids, we talked about the columns, and then we talked about the calyces, minor and major, and then all of those are going to drain urine into the renal pelvis, the ureter, and down towards the bladder.